Child and Adolescent Behavioral Health welcomes you to another great episode of our Health, Hope, and Happiness podcast brought to you by Stifel. On today's segment, GlenOak High School athletic trainer Alex Shaheen is our guest, and he will be discussing the best ways to keep our athletes healthy and what role trainers use to fit into this. Welcome to the podcast, Alex.
Hi, thanks for having me.
So tell our listeners a little bit about yourself, where you grew up, went to high school, college, and then how long you've been a trainer and why you want to be, or why you chose to be a trainer.
So I am a Plain Township born and raised. So I grew up in Plain Township. I went to Plain local schools all the way throughout. So when I was at GlenOak High School, I was fortunate enough to be exposed to athletic training as an option for me. I took a class, a health science class that was offered to sophomores. I only took it because my girlfriend was in the class and I had a study hall. So I took that course. I found out athletic training was taught by the athletic trainer. So I found out about athletic training that way, and it merged two of my interests, which would be sports and medicine. And I ended up taking the program, which is what I teach now at GlenOak, taught by Kristen Wellman. So she was one of my early influences to become an athletic trainer. And from graduating from GlenOak, I had a lot of positive experience in working with the sports teams here. And I went to Mount Union College. I ended up going to Mount Union College and graduating from the University of Mount Union. So I was part of that transition of that great institution. Where I learned about athletic training from Dan Gorman, who was the program director at the time, and he was a great mentor to me. I had a lot of great experiences working with the Mount Union sports programs. I got experience with Marlington High School, and it led to my first jobs with. I worked for the NFL in high school player development, and at my first job was at Alliance High School. After 1 year at Alliance, my alma mater came knocking. They said they needed a teacher for the sports medicine program and an athletic trainer. And that's kind of the type of school I wanted to be at, was a large high school. I really like working with high school athletes. I work with college, professional, and high school athletes, and I really like that setting. So I've been here for 12 years, and I love every minute of it. I have a chance to do for my students what my teachers did for me in terms of finding a passion of mine, which is sports medicine. So sports medicine is a great conduit because we have 700 athletes at GlenOak, and those are all patients for us. So as an athletic trainer, I get to treat those patients, and the students get to see from the ground level all the way back to return to play what is done in sports medicine. So it's a cool thing to see somebody, and especially when a student graduates and becomes a colleague, that's a really cool experience. So that's how I ended up, and that's how I got here today. So this 12 years later, I'm still here.
Not that I followed the athletic training path, but I was born and raised in Plain Township, graduated from GlenOak, also a Mount Union College graduate, so we kind of followed those same paths.
Two smart guys here.
I can attest to how well of a trainer you are. You got to work with both of my kids, and my daughter was even one of your students at one time. So we got some good expertise going on here. So what is your primary role as an athletic trainer today, and how has it changed at all from when you first started?
So athletic trainers are multi-skilled healthcare professionals. We're tasked with injury prevention, recognition, treatment, rehabilitation, all the way up to that return to play. So we have a lot of different skills, and we can work with a lot of different professions. One thing that has changed a lot since I started was the opportunities that were available for athletic trainers. There are opportunities in industrial settings. We saw a lot of athletic trainers move to industrial settings, working in factories, FedEx, Amazon, those are examples of companies that actually will hire athletic trainers because you're working with a very active population. Obviously, you think of athletic trainers in a school or school athletic setting, so high school, college, and then all the way up to professional. We see them a lot in the military. So that's one thing that has really grown since I was starting. I thought athletic training was one thing, and it's really evolved into a lot of different spaces. And technology, just as it's impacted everybody, has impacted my profession. So staying on top of trends, uh, especially sports science becoming a lot more popular. You've seen that silo of sports science expand into nutrition, human performance, and injury prevention. So we've done a lot of different things with technology at GlenOak to try to reduce our risk of injuries. We've been tracking using GPS sensors and impact sensors on our uh, soccer, lacrosse, and football players for the past couple of years, and that gives us an idea of like the type of stress and loads that these athletes are taking on. So uh, that's one thing where I really didn't get a lot of education on. I got a lot more education on the job because that technology wasn't out there. So it's pretty cool to see that progress.
So, what are some of the biggest hurdles you see in your role as a trainer?
So sports sports medicine specifically, you're dealing with a task that the human body sometimes is pushing itself to a higher limit. So in an average outpatient clinic, you might have somebody there who just got a hip replacement or is trying to return to work, and we're asking them to do tasks that are part of their activities of daily life. So, getting up, dressing themselves, uh, being able to get out of the bathtub, maybe be able to work at a desk. Uh, with athletes, we're asking them to do a little bit more than that. Dunk a basketball, to be able to run over a hurdle. So when we look at athletes who want to get back into the game, we want to make sure that they're doing that as safely as possible and that we're not going to put them at any detriment to themselves or their quality of life. So that's a conversation that needs to be had with, especially working with pediatrics. As you guys know, you have to make the parent involved in that decision, and also make sure that the coach has that understanding as well.
Yeah, so that leads into kind of the next question. How do you balance the needs of the coach, the athlete, and the parent? Because if an athlete gets injured, all three entities kind of want them back in their field or their sport playing as quickly as possible.
So I approach sports medicine as an idea of, who are the stakeholders in these decisions. So clearly parents, the athlete or patient, and coaches are stakeholders in the decisions that we make. And I think if we come from a standpoint where all three, as a parent and as an athlete and as a coach, we all want the best product on the field or court that we can produce. So that athlete wants to be the best version of themselves on the court. And making sure that we are all working towards that one goal. And it needs to be goal oriented. You need to know where you're going as a team, where you're going in terms of your return to play, or what are you willing to play through as an athlete. Um, is that athlete who might be at 90 or 80% better than the next guy up? And sometimes the answer is yes. So then we go to, what are the risks of this athlete participating with this particular malady? So a sprained ankle, for example, it might be better for that athlete to rest so we get that back to 100%. So we're not playing at 80% all year, but we miss 2 weeks and we can get somebody back at 100%. And we do the right rehab, we do the right return to play and get them back. And usually that means for a coach, you're going to get a better product and a better team. So making sure that that's the goal for all the athletes is, or not there's all the athletes, but everybody involved. That's going to be important so that everybody has understanding and we all have communication, which is key in every aspect of life, not just in making decisions in sports.
Yeah, so you touched on it a little bit earlier in your first answer. How do you stay up to date on the latest advancements in your profession? So, uh, we all hear now in the summer teachers have to take brush up classes. Is that the same for you? Or are you kind of back in the classroom all year round? How do you keep up to date on that?
So as an athletic trainer, to maintain my certification and my license, I have to average about 25 hours of continuing education a year. So I seek out continuing education that would benefit me in my setting and bring concepts that are going to benefit my patients to GlenOak. So I'm a member of the NATA and the OATA. They often offer a lot of good programming. That's the National Athletic Trainers Association and the Ohio Athletic Trainers Association. They offer programming for athletic trainers to learn from evidence-based research. I'm also being in the classroom and teaching keeps me fresh and up to date because I'm often reading things that I want to bring to my class and concepts that are new. So I kind of have to stay up to date on that. And I'm a clinical instructor for Kent State University's athletic training education program. So being around those young uh, budding athletic trainers keeps me fresh and new on current concepts because I learn about what they're learning. And if they bring something to me, I got to be able to talk about it in the field. So I think having that education mindset really has helped me stay on top of those things. I think in healthcare, you have to be an educator to some respect in
Mhm.
terms of what you're going to explain to the patient and tell the patient. So being an educator has really helped me learn as well as teach.
Great. In today's environment, most high schools have more than 20 sports, and I'm not even sure anymore how many GlenOak has. But how do
About the
you or your team manage more than 20 sports in a school calendar year? Which, if you're talking about football, some of that starts in July. So it's really more of almost a full calendar year rather than a school calendar year.
Yeah, I mean, we begin acclimating in terms of putting our pads on. We are we have the ability to go full pads on August 1st now. So, that tells you right there that we are starting earlier and there's always talk of spring football. So we have another myself and another full-time athletic trainer from the Cleveland Clinic. So between the two of us, we have to share our time. We have an understanding of what the highest risk of injury is. Football, it's a collision sport. It's not a contact sport, it's a collision sport. So you need to have somebody there with those athletes on site because something can happen immediately. So we always make sure we have somebody at football practice. That's usually me. And then when it comes to the other sports, I think if you have a good sports medicine program, so from an administrative standpoint, if you have coaches who understand when the athletic trainers are available, how to report injuries, and also have a good understanding of first aid, being able to recognize emergencies, that's going to help you in terms of your manpower. So if you might not have an athletic trainer at every site, but if you have coaches who know how to communicate well with the athletic trainer, it can minimize unnecessary doctor's appointments or unnecessary emergency room appointments, where an athletic trainer can step in, provide that care, provide that first aid, give advising to the parents on what needs to be done in that situation. So I think when you have a good emergency action plan, and I think with the Damar Hamlin situation, emergency action plans became front focus in all of athletics is how do you plan for an event when something catastrophic happens, how do you activate the emergency medical system? And I think we do a good job of that at GlenOak, and when communicating with coaches, communicating between healthcare providers, doctors, physical therapists, whoever's part of that sports medicine team. So it's more, you think you just have 2 athletic trainers and 700 athletes, but it's more than that. It's that support system that you put in place where they're able to react and respond, and the chain of command is clearly delineated.
Nice. So today, playing one sport is a year-round endeavor. Many athletes are lifting year-round, working at agility and performance gyms. What advice can you give to these athletes to protect against injury or overdoing it? And then also from an athletic trainer, would you recommend kids being more multi-sport rather than singular sport?
Yes, yes, and yes. Sport specialization is one of the biggest issues we see at a young age, and it's multiplied. I'm sure when you were participating in sports to now, there's AAUs, there's JOs, there's travel ball, and everybody has this time and monetary investment that they have to make for their child, or else they feel like they're falling behind. But when you're talking about doing the same movements, the same things over and over again, you're going to be overworking the same muscles, putting yourself at risk for more overuse injuries, and it's going to end up detrimenting you in the long term. So there is a point in time when scholarship money becomes part of the conversation. Maturity reaches a certain point where it's okay to focus on a sport. I'm not saying you have to be a multi-sport athlete all the way up to your senior year in high school, but doing cross training, being able to have an off season, a true off season where you're working on things, speed, agility, strength, and injury prevention, gives you the ability to have more longevity in a sport. We're always concerned about burnout and overtraining in athletes who are specializing in a sport. So that's going to be a different age for different types of athletes and different kids in terms of their development. But unless you're getting clear signals early that, this is a sport for you and this is really where you're going to maybe have some scholarship opportunity, it's okay to be diversified. Just like you would want an investment portfolio to be diversified, we want those skills to be diversified. So if I could talk to parents specifically, I'd say, don't specialize too early. And if you are going to be a one sport athlete, make sure you have an off season and some time to rest and recover.
So we've touched on this a little bit as well. An athlete gets injured. What role does your training staff play in helping that athlete navigate the injury? So let's just go with the football field and somebody gets injured during the game.
So a big role in athletic training is helping navigate, especially in a pediatric setting when you're talking about minors. It could be a scary thing for an athlete, especially when somebody identifies as an athlete, an injury occurring. So making sure that you're counseling them through the process every step of the way. So when we have an injury, we're on the ground level there. We're going to have our emergency survey or primary survey to make sure that the athlete is not suffering any sort of life-threatening conditions. Then we go into our evaluation. Sometimes a team physician will be present, will be able to help with that evaluation. If not, the athletic trainer is responsible for that evaluation and then the referral to follow. So we can decide whether this is something that we can do basic first aid in-house, or if we need to make a referral to a physician, whether that be family medicine, sports medicine, or an orthopedist. Then, depending what happens with that referral, if there's any sort of rehab or follow-up appointments that need to be made, we're going to be either providing care or providing guidance the rest of the way. So working with physical therapists as a part of supplementing their rehabilitation programs, and having an athletic trainer at a school can minimize some of the time lost, because you're able to stay in school, do rehab at school, communicate with the physical therapist on goals and benchmarks. And then when we talk about all these players, whether it's paramedics, team doctors, family medicine, or physical therapists or physical therapy assistants, we're all part of the sports medicine team who has one goal, and that's going to make sure that this athlete returns to play as quickly and safely as possible. So making sure that everybody is on the same page, as from the medical side as well as the human performance side. So strength coaches can be brought in that loop, parents, and obviously the patient is going to be at the center of that discussion.
And sometimes you talked about how athletes and how you communicate with the families, but a return to play decision could be they only play for one quarter and kind of work their way back in. Is that accurate, or when somebody comes back, they can just go full go?
Well, and that's a discussion that if we have a good discussion with a coach and a good relationship with a coach, that's possible. A gradual return to play or managing minutes is something that we definitely will do, and that's tough to do without an athletic trainer, because a coach is going to just get a return to play from a doctor and say, okay, well, they're clear, let's go. But understanding that conditioning also has to be a part of that. We have a 2-week conditioning period when we return to a sport. We should also make sure that we're gradually increasing the load or the minutes. And in the NBA, they call that load management, which is kind of a dirty word if you're an NBA fan, but it's something to think about when you're talking about a course of 82 games. Now, a high school season is going to be condensed, so that might not be it. They might not have as long of a return. But yeah, definitely we can do some graded protocols. In the state of Ohio, for a concussion, it has to be a graded protocol. So you get a return to play from a doctor, they still need to go through the proper steps to make sure that none of those symptoms come back. So we've done a great job in Ohio from a legislative standpoint, making sure that athletes aren't returning too soon from a concussion because of that graded protocol that we put in place.
So for athletes today, diet is important. As an athletic trainer, do you meet with teams to discuss nutrition and hydration to correlate those two to kind of prevent injuries?
So nutrition and hydration are two things that should be a part of an education program for athletes. I'm not in my scope. I cannot give meal plans or nutrition advice in particular. That would be something that a registered dietitian would have to do. But any open source information that's available is important in the education process as an athlete. So I teach a college nutrition course for my seniors. And part of that is nutrition literacy. So understanding how nutrients turn to energy, how we can fuel the body with those nutrients. I always liken it to, if you're going to take a trip, you're not going to decide where the gas stations are around the destination. You're going to want to fuel up before you go there. So making sure that the body's properly fueled for the sport that you're doing, right? So different sports have different energy requirements. So having a good understanding of, are you an aerobic or anaerobic athlete? Let's start there. Let's start with the type of fuel that you're putting in your body. What is the difference between a carb, a protein, and a fat? How much energy are we getting from them? And can we just read a food label and have an idea of where that energy is coming from? And then when it comes to hydration, one of the practices we put in place, and two things that any athlete can do, is they can weigh in and weigh out. So when you go to practice, take a look at your weight. After you leave practice, take a look at your weight and see how many pounds of water you are losing during that bout of exercise. So you can replace that water with ounces of fluid, right? So you know that you're losing that water, and you can replace that water with that fluid. And there's a lot of factors that go into it, but monitoring your urine color. So we want our hydrated person, somebody who what we would call euhydration, to be to be a color that's kind of a pale yellow, clear to a pale yellow. Depending on what's in the diet, that might change the color of the urine, but urine color is probably the easiest way to monitor whether or not you're hydrated, because we look at that concentration of that color in that urine. So I would say urine color, weighing in and weighing out, and understanding what makes a nutritious food, and knowing where your energy is coming from. And there's calculations you can do to see what your daily recommended intake is. Everything that's on a food label is based on 2,000 calories, but we could be seeing some distance athletes at high school whose nutrition requirements is well at 3,000 calories. Okay, so how are we going to get that into those 3 meals? How are we going to replenish those nutrients and make sure that we're properly fueled?
Nice. So many athletes today, as we mentioned, are working out year-round. Many are also using creatine or other protein powders to kind of enhance that muscle buildup. As a trainer, do you provide any advice on best practices for using supplements, or are you even allowed to? And are they safe products?
My advice, or my disclaimer here would be, I cannot give advice on supplements to high school athletes. When it comes to supplements, as a general rule of thumb, they are not regulated. So make sure that they are tested by a third party for banned substances. Okay, so that's one thing I would look for, is make sure that there are some third party testing that's being done, and there are labels that will be on the product for that. So that way, if you are using a supplement, that you don't test for a banned substance. We don't test in high school, but you might get tested in college, and if it's something that you've been using. And supplements are supposed to be just that. They're supposed to supplement your diet. So we look at a recommendation of the average person should get about 0.8 grams of protein per kilogram of body weight. You average that out, that's about half your body weight in pounds in grams of protein. Okay, that's for the average person. That's usually sufficient for most people. But athletes, we recommend about 1.2 to 2 grams per kilogram of body weight. So that's like essentially your body weight in pounds. It could be up to your body weight in pounds in grams of protein. So if you're not getting that through your diet, and that's where food literacy comes into play. If you're not getting those proteins through your diet, maybe it's something that you think about supplementing from a good source. Whey protein or animal source protein is a complete protein, but there's also soy and pea proteins that are available out there as well. And you can kind of piecemeal complementing proteins, whether they're from plant or other sources, to get a good protein. And but it should be supplement. If you can't get it through your diet, then maybe you have to supplement. Maybe if you're a vegetarian, lactose intolerant, whatever that might be, you kind of start talking about supplements, and that's what supplements are supposed to be. When it comes to creatine, okay, creatine, protein, and caffeine are 3 well-studied supplements. We know what they do. We know they're effective. Creatine became kind of a dirty word because it was being abused by some people who ended up having some kidney complications. But on a large scale, it's relatively safe. It's relatively effective at 3 to 5 grams a day. But there are no studies really out there on what the impact is on a pediatric patient. So there's my caveat there in terms of high school athletes using creatine. We know that it can enhance some benefits or have some benefits in adults, and it is relatively safe unless you have some sort of predisposed kidney condition. And if you're just taking regular creatine, now when we talk about pre-workouts, there might be some other things thrown in there. So I'm just talking solely about caffeine in less than 400 milligrams a day, protein in those thresholds that we talked about, and creatine at that safe level. It's probably a discussion that parents should have. It's something that I would seek out some reliable sources. The American College of Sports Medicine being a good source for information on exercise.
Nice. So how does an athletic trainer support a team with their mental and emotional well-being, which is kind of a hot topic, kind of not only in the sports world, but outside of the sports world as well.
Well, we talked about things that have changed since I've become an athletic trainer, and that's definitely a source of a lot of education that I've sought out. The Ohio Athletic Trainers Association has offered a mental health first aid training that I've undergone. So I want all my coaches to have a knowledge of first aid in terms of an injury, and I want to be able to be knowledgeable of mental health first aid. I'm not an expert. I'm not a psychologist or a psychiatrist, but I want to be able to recognize and make the proper decisions of when somebody's in crisis or when somebody's having issues. So mental health first aid training is something that a lot of athletic trainers are doing to add that tool to their tool chest, in addition to whatever psychological training we get. Now, we all know that in terms of return to play, there's a physical barrier and a psychological barrier that needs to be overcome. When I see an athlete go through an injury, they almost go through all the stages of grief. They have that denial, that anger, that acceptance eventually. So you need to be able to help them as counseling through that. So mental health first aid has been a useful tool for me. One thing that we do that's been added to our physical form is a PHQ. Now, we don't do the full PHQ 9, we do a PHQ 4, but that can also flag some incoming concerns that we might have for mental health. So we can make the proper referral. So just like we want to make the proper referral for an orthopedist, so somebody gets treatment, we want to make sure that we're being able to recognize those issues as they come in as athletes in a pre-participation exam.
And so working through the mental and emotional well-being, how does that help to create a positive environment within the whole athletic department?
So one of the benefits of participating in a sport, and something that I would want my kids to get out of a sport, is being able to work through adversity. You never want to downplay what somebody's going through, but if losing a game on senior night is the worst thing that ever happens to you, I think when you look back on your life, you've lived a pretty good life. And sports is a great place to learn those types of lessons, that not everything's going to go your way. We're going to build some resilience. We're going to go through some adversity. And in sports medicine, we certainly have to go over hurdles and adversity, especially if somebody's dealing with sudden injury, whether it's acute or long-term chronic injury. Working through those types of things and having that reward of maybe just getting back on the field, for a couple plays can be really a gratifying experience. So in a athletic environment, we want to make sure that we're building resilience, that we're learning from our losses, and we're becoming a better person, because sports are going to end for everybody at some point. Okay. Unless, and I don't know, golf, pickleball, maybe be the exceptions, but a lot of sports are going to end for people at some point. So what are you going to take from that experience? Other than hopefully you have a lot of fun, but you need to also learn some resilience and and overcome some adversity. So that's what we talk a lot about in the training room. And the training room is a safe place for a lot of students to express some of those feelings. So we want to make sure we have a safe space for students to be able to express their thoughts. And for whatever reason, those treatment tables behind me, it's like the barber shop. Those floodgates open and those discussions happen.
I know. I sat on one of them. You helped me out when I had a minor injury this winter, so it was awesome. I know we barely scratched
it's an open door policy here, so.
I know we barely scratched the surface on this topic, but is there anything else you want to add before we wrap it up?
No, March is whether you knew it or not, March is National Athletic Training Month.
I
So
did not know that.
I'm
So
glad you asked me on in March. So I like to promote the profession. It's a great profession. There's nothing better than watching sports and just waiting for something bad to happen. It's a rare job where the less you're doing, the happier everybody is at a sporting event. So I appreciate you having me on, and I think I can speak on the behalf of the Plain local community that we're so happy to have you guys as partners in the school, and what you guys do for our students and the youth in our community. I appreciate you having me on, and I enjoyed our talk today.
yeah, we always enjoy our great partnership with Plain Local. Of course, as a grad, it's extra gratifying. So this wraps up another great segment of the Health, Hope, and Happiness podcast brought to you by Stifel. A special thanks to Alex Shaheen for joining us today and sharing his insights, and look forward to another podcast soon. Thanks.